Hi everybody, my name is Swati Maan. I'm a dentist. We all know our body is magical. It goes through various challenges and changes throughout our life. But the female body goes through a very major phase, what we call as a menopause. The body changes in general. But today my talk is about the five major factors or the five major changes that you can expect to happen inside the mouth or around your teeth during premenopause and menopause. So let's talk about that. First major change happens is into your gums. The gums look more swelled, they look more red, they look more tender, and sometimes we also see the recession of gum. Number two, we see some mobility in the teeth, or we see that our teeth are changing the position, or they're slightly drifting from their position. Number three, decrease in the saliva production, or what we call as a dry mouth, which means the mouth feels dry in general. You feel the urge to have a sip of water all the time. Number four, the burning mouth syndrome, which means to say that the mouth will have a weird burning sensation or a very altered taste sensation without any patches. And that majorly happens around your cheeks, your lips, or around the tongue. Number five is the painful jaw, which means around the bony structure of your jaw, you start to feel some tenderness or pain. All these changes sometimes are inevitable because that's all happening because of the decrease in the estrogen level, which is a female hormone in the fifth decade of life, which is of course associated with the menopause. But here I'm going to give you five very important tips that you can use to combat those changes and fight for any risks that might happen in the long term. So the first thing to do is book yourself with your dentist for a complete dental checkup with the X-ray. The checkup is important to see if there is any problem because at this stage, any fillings or any gum problems should be treated as soon as possible. The X-ray will reveal the health of the bony structure because there are the chances of osteoporosis. So if your dentist sees that there has been an increased amount of bone loss or there is a decrease in the density of the bony structure, you should be referred to your general practitioner or your doctor for the further investigation of osteoporosis. Number two, the regular scale and polish is very important. Decrease in the estrogen level makes your mouth more vulnerable to catch more plaque and tartar. So every 6 monthly scale and polish at this stage will be extremely vital, followed by a good regime to follow at home in terms of regular brushing, flossing, etc. Number three, if you're struggling with the dry mouth, then keeping yourself hydrated will be very important. Talking to your dentist about the saliva replacement therapy, and in the worst case, any prescribed medication might be useful. Number four, changing the diet slightly. So having a healthy diet, decrease the amount of sugar intake, decrease the amount of alcohol consumption, replacing your coffee with some herbal teas, and trying to quit smoking will be quite kind to your mouth at this stage as well. Number five, if the situation is really getting worse and if you see none of the other factors are working for you, then talking to your doctor about the hormonal replacement therapy will be quite a good idea. Your doctor will explain you what are the risks associated with hormonal replacement therapy because that increases the estrogen level in the body. So talking to your doctor about that in a worse situation will be helpful for some people. So all your body needs right now is more care. It has served us so well all these years and it's a little bit of a payback time. So I hope that you found this video informative. If you have any questions, feel free to drop me the message in the comment section. I'll try and get back to you. Thank you again all for watching and I wish you all the very best. Thank you.